And there's a confirmed case of measles here in Virginia. Health officials say a Howard County, Maryland resident who traveled overseas, then landed at Dulles International Airport last week, has a confirmed case of measles. The World Health Organization declared measles eradicated back in 2000, but the disease has reemerged. The total number of cases in the outbreak in Texas is close to 200 people. New Mexico also reporting 30 cases. Now, this report in Northern Virginia. 10 News reporter Jason Freund is working for you and spoke with a local pediatrician about how you can protect yourself from measles and how to spot some of the warning signs.
It's a highly contagious virus spread through the air by sneezing or coughing. At the start, you'll normally experience flu-like symptoms such as a runny nose or a fever. But it's the second phase that will confirm whether or not you have measles.
The difference with measles is that it's followed by a characteristic red rash that spreads from the face downward. So it kind of starts around the hairline and moves down the face onto the body.
It's what happens after that rash shows up that makes measles so dangerous and, according to the CDC, has already put over 200 people in the hospital.
There's severe complications post-measles, which include pneumonia, encephalitis, and severe debilitating respiratory disease.
Now, normally an MMR vaccine is given at the ages of 1 and 4, but when I spoke with Dr. Fulton, he told me that the primary cause for this high risk of hospitalizations is a decrease in vaccination rates.
If you're exposed to the measles virus and you're vaccinated, you're likely to defend it off fairly well. If you have no vaccine, it's a very debilitating illness that can make you very sick very quickly.
Dr. Fulton says that the best way to stay safe from measles is to get your kids the vaccine, and perhaps even adults should consider boosting up.
A lot of folks from the CDC and the WHO are recommending not getting titers rather than just going and getting a booster for MMR if you're concerned about being in an endemic area.
Because the less amount of people who are unvaccinated, the more measles could spread.
The biggest thing to do is to ensure that you get vaccinated and your loved ones get vaccinated and your children get vaccinated, because the people that are highest risk for having complications from measles are young children and the immunocompromised. The concept of herd immunity doesn't exist when the herd doesn't have protection from the illness.
I'm Jason Freund, 10 News, working for you.